Hey, Matthew Holt, you hear the crickets? You hear the crickets? Or maybe you hear the chirping from health tech Twitter, particularly Alyssa Jaffe, who says, hey, not a lot of deal flow. What's going on? Let's find out. It's the June 3rd episode of Health Tech Deals. So yeah, Alyssa Jaffe, Seven Wire Ventures is like, it's so quiet out there in the health tech deal flow. What's going on? And then quick to cancel us is Eugene Burakovich, who comes in there with this tweet like, yeah, good luck, Jessica DaMassa and Matthew Holt. Looks like you're out of a job. First of all, this is not our job. This is some kind of punishment that he and I have earned due to some misdealings in a past life. Second of all, you're like quick to jump in there and be like, oh yeah, you know what? That's great, Alyssa. Now I can be a comedian like I've always wanted to be. Thanks. Thanks a lot.
No. Alyssa said that I should be the comedian I always wanted to be. And I went, hang on, I already am. This is it. This is me being as funny as I can. By the way,
yeah,
that's not quite right. There's still a lot of deals going on. We've had a lot of deals this year. And yeah, clearly the number of the dollars associated with each deal has gone down. The 100 million, 200 million, 300 million, $600 million rounds, they're probably in the past for a while. And yeah, Sequoia has done, no doubt winter is coming. And, yes, Carbon Health laid off people yesterday. So yeah, I get all that. But here's the little thing that they're not saying, right? The markets are down tremendously. The public markets are down. It's weighing on the private markets. The public markets have been ticking up a little bit the last, few weeks. They were way down, but, everyone's up a little bit in the last stop. The NASDAQ's up about 10-15% since, since the dog days of May, if you like. And maybe summer is coming and spring growth and who knows. But anyway, yeah, I get it. It's clearly not going to be as crazy as it was. But I would say we will be here to report on the deals, even if they're the deals of, the piranhas coming around, chewing up.
Oh, yeah. The piranhas. As this industry burns down around us, you and I are going to be here reporting on the fire from the ashes.
All right, before we go to the 2 minutes.
Yes.
We have a new sponsor to tell people about.
We do. AHIP is sponsoring us. And so we are going to shout out the AHIP conference, which is taking place in Las Vegas in a couple weeks. And you guys can join us there with a discount. So Matthew Holt, tell us the where, the when, how much they get off the ticket price. Okay,
it's 100. If you Google AHIP conference 2022, you'll get to the point where you register. Once you register, we'll do all that. It's about I think the non-member rate is a little over $1,000. Your AHIP member rate's a little under $1,000 to member. You get $100 off if you use the code THCB.
Yes.
So please do that, and we'll look forward to it. We'll be in Vegas. You can come find us. I'm already working on the party schedule even as we speak. And the conference, great stuff. Lots of senior executives from health plans. Common, who's a rapper, will be there.
Ooh. Nothing says a good time like Common the rapper, a bunch of health plan folks in Las Vegas.
It will be a good time.
It will. All right, get your timer. Let's go through these deals that nobody even believes they're happening anymore. All right, Hint Health, they get 45 million, brings their total up to 60. This is a direct primary care operating system.
Absolutely. So direct primary care has been growing slowly. This is where you get a direct primary care doctor. They usually cut it down to 500 or 600 patients per panel. And they need a bunch of services to charge the money. It's usually sort of between 75 and 200 to 250 a month. They manage that whole thing. They also put a bunch of other stuff in terms of referrals and other membership management and other things on top of that. And it works pretty well. Hint Health is run by Kiwi, Zach Holsworth, who's been doing this for a while, puts together a nice conference. In fact, they have a conference going on next week in Denver about this. Good luck to them. It's a big jump. They only raised 15 before. This means real business.
All right, Moxe Health, spelled M-O-X-E, gets 30 million, brings their total up to 36. You say this is Redox-like.
Yeah, so you've got Redox who kind of have a platform that allows you to plug into health systems with your technology. You've got Human API and Health Gorilla who move stuff around. These guys move stuff around more between providers and payers, Moxe. They've been going for a while. I couldn't figure out how much money they'd raised before, but 30 million is quite a chunk at this stage of the game. So I'm surprised that that kind of space they're still going so well.
Okay, sorry. uMotif gets 25 million, brings your total up to 36. This is a clinical trials software company, but how is this different than what's there?
Bruce Hellman's the guy to this. It started out as a patient symptom tracking thing, and they merged it into like a patient, all the things patients use for clinical trials. So it's a little bit specialized. A good bunch of Brits. Taking a while to get going, but they just raised some money last year, and now even more this.
All right, Fairtility gets 15 million, brings your total up to 18.5.
This is the Chloe EQ AI platform designed to help providers improve IVF outcomes. I have no idea what the hell this is about, but my God, is there enough going on in fertility?
All right, what about Circles? They get 16.5 million, brings your total up to 24.5 million. This is an online emotional peer support company.
So this is, you may recall our friends at Supportive, of whom I'm a teeny angel.
I do.
Who have got like an automated peer support thing. Peer support is a big deal in the world of mental health. These guys are kind of latecomers. They've only been going since 2020. I don't know what is different about them than any others, but they've raised $25 million over time, with another 16 just coming this round. They have, I think, trained mental health professionals doing the peer group, and I think it's a weekly group rather than on-demand thing compared to some others. But it's yet another different slice of mental health. Peer support is a big deal, whether it's combined with other mental health offerings like therapy and medication or whatever. Or you recall our friends at Equip in the eating disorder space have a lot of peer support, or whether it's a group peer support. It's all good. More and more of this stuff we'll see around, and hopefully Supportive will get out and make me very rich before the. We'll see.
It's all about you. All about
me as usual.
And for more of him, if you just can't get enough, especially of his comedic stylings, Alyssa, head on over to Twitter. He is at BoltyBoy. I am at Jess.
No. She doesn't think I'm funny yet. I'm going to be funny after this show is over, because I get to go practice.
Still not funny now, especially now, like not right in this moment.
Sorry, you were saying you were.
I was saying. I am at Jess DaMassa. And the humor continues over at thehealthcareblog.com, where you can sign up for our email newsletter and get these delightful little health tech deals episodes delivered directly into your inbox every week or so, or whenever we feel like it. Also, more info on that AHIP conference with the reg code you need to get the $100 off in the ad in the newsletter.
EHCB. There's also a big ad at the front of the healthcare blog. You can just go find it. All right, we should probably leave. We'll see you on Monday.
All right, bye.